Hello, everyone. Good morning. This is Miss Henderson, and today I'm presenting to you the second part of the chapter on infection control. Um, just as a reminder, these videos are meant to supplement your reading, and they're not meant to replace your reading. If you like this video, please give it a thumbs up and subscribe to my channel so you will not miss another upcoming videos. So today I wanted to talk about the personal protective equipment. So the personal protective equipment are equipment such as caps, gown, face mask, goggles, and glove. So these equipments are used in order to minimize the transmission of infection. So what do I mean by that? For example, if a nurse is emptying a Foley catheter bag where there is a potential for splashing of body fluids. It's critical that the nurse wears a goggle to protect her eyes and her face from any type of body fluids. So these equipments again are used to prevent the transmission of infection, and we should always as nurses use these equipment when it's appropriate. So the next slide talks about a little bit about a concept map. So I wanted to create this simple concept map to deepen your understanding in how to formulate a nursing diagnosis and how to use that nursing diagnosis in order to create in nursing goals and nursing interventions. So let's say concept maps are used a lot in teaching, and there's a lot of research on concept map and how it helps to create critical thinking, and it helps where you can take a certain concept and you can kind of navigate the different ways and the different routes that it can link together, and it actually helps students to create this critical thinking, and not only to kind of be think in one certain way, but it helps you to think outside of the box. And this is why I use a lot of times I use concept maps, I use case studies into my teaching, so it can help students to create that critical thinking. So let's say you have a patient that is a 64-year-old female that comes into the clinical setting, and the patient is complaining like of abdominal pain, cramping, and the patient states that she had loose bowel movements times 3 days, and the bowel movements have a foul odor, and she's experiencing pain and cramping. So as a nurse, taking that simple information that the patient relate to you. So how are you going to formulate a nursing diagnosis based on that little case study that I've just read to you? So the patient have diarrhea, so we can say nursing diagnosis, diarrhea related. RT stands for related to infectious process, secondary to C. diff enteritis. So the patient probably have C. diff. Evidence, so now this is our objective data, our objective assessment based on what the client told you. So evidence by 3 to 4 loose liquid foul smelling stools per day and positive lab culture. Maybe the doctor order a culture of the stool to rule out C. diff toxin. So this is how we formulate a nursing diagnosis. Now, based on our nursing diagnosis, we have to also link to a nursing goal. What would be our nursing goal for this patient? As we know, when a patient is having diarrhea or they're having nausea and vomiting, they are also at risk for what? Dehydration. They are also at risk for fluid and electrolyte imbalance. So the nursing goals will be patient will remain free from signs and symptoms of infection times 14 days. Patient will have a decreased loose bowel movements in the next 72 hours. You can also say patient will report decrease in abdominal pain or cramping within the next 24 hours. So we have our goals here. Now, based on our goals, we have to have nursing interventions. So nursing intervention has to do what we are going to do as a nurse in order to achieve our goals. So keep patient hydrated. So if the patient is able to drink by mouth, so it's important that you encourage fluids. If the patient is not able to drink fluids, then maybe we'll have to insert an IV and give the patient IV fluids. We'll have a stool for C. diff. Maybe the doctor may order antibiotics, Flagyl or vancomycin to be administered to the patient. Of course, C. diff toxin is transmitted through contact precautions. So we will also initiate contact precautions and we will use the appropriate PPE, personal protective equipment, such as a gown, a mask, and gloves. And also it's important to do hand hygiene. Hand hygiene is so critical for C. diff. It's important to perform hand hygiene with warm water and soap for 15 to 20 minutes in order to minimize the transmission of C. diff toxin. So patient teaching, it's also critical as a nurse, as a registered nurse, that when we are making a plan of care for a patient, that we teach our patients. So what are some things as a nurse that you're going to teach your patient? You'll teach them proper hand hygiene. You will demonstrate to your patient how to perform proper hand hygiene. You will also set up a room, a single room, or maybe you want to cohort two patients in the same room that has the same this infectious process. Two patients with C. diff will place into the same room. So equipments, leave equipments for the client in the room, like if you're using a blood pressure kit or a blood pressure machine to take that patient's vital sign, leave those equipments in the client's room. That way you're minimizing this transmission of the infection, taking the same machine, using it in several patients on the unit. That's a way that you're transmitting the infection. So also teach a patient about the completion of the full course of the antibiotics. You also teach patients about signs and symptoms of side effects to the antibiotics and to increase their fluid intake. So that's it there. And then you'll have a nursing evaluation. So your nursing evaluation is based on your nursing interventions. Or your interventions were they met? Do you need to go back and tweak these interventions? Sometimes you may have to go back and tweak it. Some of the interventions may work, some may not work. So it's a continual process whereby you have to go and make adjustments to your nursing intervention. So Nursing evaluation, client remains free from infection. Client have a decreased number of foul-smelling loose stools from 4 to 2 within the next 24 hours. Client remain free from signs and symptoms of dehydration because we're increasing their fluids, we're administering antibiotics, and so on and so forth. So that's it there for the concept map. So it's critical that know and be familiar how to formulate a nursing, Ananda nursing diagnosis. Also, how to set SMART goals. We know there are long-term goals, there are short-term goals, and there are intermediate goals. Um, how you set a goal, your goals have to be SMART. They have to be time frame, they have to be measurable, and they have to be obtainable. Okay. So, application of personal protective equipment. The type of personal protective equipment used will vary based on the level of precautions required. Perform hand hygiene immediately before and after removal of all PPE to reduce the transmission of infection. So, it's important that you always perform hand hygiene. You apply your gown, apply your face mask or your respirator N95, your goggles, your face shield, and gloves. So that's the order in how you apply a personal protective equipment. So as we know, personal protective equipment will vary based on the clinical situation. So, for example, if you have a patient with active TB, tuberculosis, the patient will be placed on a negative pressure room, and you will be required to also wear a N95 mask for that patient. On the other hand, if patient is on a droplet precaution, you are going to wear a surgical mask, so on and so forth. So it's important to be able to apply the PPE protective appropriately and removal of the PPE appropriately. So here is another slide about the application. If you look at the application process, the first is hand hygiene, then gown, then your face mask, then your respirator, then your goggles, and then your gloves. Removal of the PPE, it's actually in the reverse order. The first thing you remove is your gloves. The second is your goggles. The third is your gown. Your fourth is your mask. And your fifth is your perform hand hygiene. So it's important that you understand and you kind of memorize these sequential order in application of PPE and removal of PPE. I have a simple NCLEX style question here, and the question is asking that I'll read it to you. A patient is admitted to a medical unit for a home acquired pressure ulcer. The patient has Alzheimer's disease and has been incontinent of urine. The nurse inserts a Foley catheter. You will identify a link in the infection chain as. So what do you think is the correct answer for this question? So what will be the link? So the correct answer is the Foley catheter bag. As you know, if a patient has a Foley catheter or you have a Foley catheter and the bag is that's a port. It's an entry for infection. If the bag is hanging on the floor or the port is open, it's one of the route that infection can travel. So Foley catheter placed patient at increased risk for developing catheter associated